I'm going to record this so we can share it with folks later. But again, folks, thanks for joining us. We're going to go ahead and get today's program started. So hello and welcome to the Jefferson Educational Society's digital programming. I'm Ben Speggen. I'm a vice president at the Jefferson and am a contributing editor at the Erie Reader. Joining me in conversation is Jefferson Scholar-in-Residence Dr. Judy Lynch. Now, Dr. Lynch started her time at the Jefferson as the first chair of the think tank's Board of Trustees, and she remains on the board today. She served as the inaugural director of the Jefferson Civic Leadership Academy in 2015 and was named the Jefferson's Decadian Scholar in 2018. Amongst her many accomplishments, she spent time in academia serving as an associate professor of political science and history at Mercyhurst University and prior at Allegheny College, where she was also a part of the Civic Engagement Institute. She was a 5-term county executive in Erie and was instrumental in drafting Erie County's Home Rule Charter. Dr. Lynch is also, and sometimes I note in other programs of interest to me, also she worked as an analyst for the CIA, the Central Intelligence Agency, and she taught for 13 years at Villa Maria High School. She received her doctorate with distinction in political science in 2001 from the University of Pittsburgh and her master's degree in social studies from Gannon University. Her undergraduate degree is in history and political science, and that is from George Washington University. Leadership in times of crises, learning from Erie's law and battles. What can Erie learn today amidst the COVID-19 crisis from studying the past, specifically the tuberculosis crisis of the 19th century and the Great Depression of the 20th century? And what lessons do Dr. Katherine Law and banker Charlotte Elizabeth Battles teach us in leadership in times of crises? In this program, we will discuss that and more. Since this program is first airing live on the Jefferson's Facebook page, we will work our way through as many questions from you, the viewers, as we can as we host this event. If you do have a question, just leave it in the comments section below, and we will get to those as best we can. If you're watching this at a later date, catching this broadcast at a later time, please do feel free to send the Jefferson questions that you might have about today's program, and we'll do our best to get those to Judy. And for more information about upcoming Jefferson Educational Society programs, as well as past events and publications, please do visit our website at www.jeserie.org and like us on Facebook and follow us on Twitter and Instagram. Dr. Judy Lynch, thank you so much for joining me today.
Oh, it's my great pleasure, Ben, always.
So Judy, you have written 2 great reports for the Jefferson recently, and we'll feature links of those in the comments section, but you can find those on the Jefferson's webpage under our publications tab. You've written Erie's battle with tuberculosis, how it was won, as well as former battles Bank and Girard stood alone triumphantly during the Great Depression. Do tell us, how did you first become interested in the stories of Katherine Law, the star of the first report, and Charlotte Elizabeth Battles, the star of the second report you've written for us?
Well, one of the things, as you know, Ben, but maybe the viewing audiences do not know, that I have been researching Erie County history for a long period of time. And both of these ladies turned up in my research. One was, and I know that there, I don't know whether anybody can see or not. I can hold this book up. It is Reflections of Erie County Physicians. It is by John S. Chafee. He was a doctor, wrote this history book, and there is a part in there about Dr. Katherine Law. In addition, very fortunate in Erie County to have a number of these historical books. This is about Girard, a canal town history, and there's a great deal about the Charlotte Elizabeth Battles and the Battles family in this particular book. And I drew on both of these primarily for those short synopsis of these 2 women. But Ben, if I could, I'd just like to remind all of our viewers that this is, even though we're struggling with COVID-19, this year is extraordinarily important. It is 2020, and it is the 100th anniversary of the passing of the 19th Amendment. These two women are some of the most accomplished women in Erie County's history, and I think we can all take pride in their lives.
I think that's such a great note and such an important thing to remind people of, Judy. So I do thank you for that, and I'm glad that you brought that up, and I'm glad you showed us those resources. We'll include those in the comment section as well, where folks can learn more about that. In your report on law, we come to find a conversation between state and local governments, and locally institutions were established to care for tuberculosis patients. That was an authority granted by the state, and then the state funded that initiative. Can you walk us through the process of how that happened? Local and state government really working together through a public health crisis, because I think we can learn from that today as well.
Well, thank you for that question, Ben. And I often get into conversations about Erie County government with various individuals. And the one thing that I keep reiterating is that county government is an administrative arm of the state of Pennsylvania. Originally, when counties were created, there was not all of this technology and rapid way in which we can contact each other. And so the state had to have a way in which to implement its policies on the local level. And it chose that to do through the counties, and it created the county commissioners to be their agents on the local level. So that's kind of a description. Now, one of the things is we're just so locked into COVID-19, we forget that pandemics are kind of a repeated occurrence in human history. They have been a scourge throughout the period of time on which humans have inhabited the earth. And one of the largest, most significant of those has been tuberculosis. And tuberculosis at the end of the 19th century was killing over 100,000 people a year. That is more than the persons dying now from COVID-19. So tuberculosis was a greater, in a sense, pandemic. And it stretched through the world. It was not isolated to the United States. And so, of course, there was a concerted effort to get a handle on this scourge, this disease, and to eliminate it if possible. People who are older in their 70s and 80s can remember the Christmas seals and the programs that were instituted in order to gain money, in order to use that money to investigate the occurrence of tuberculosis and get down to the origins of it. And eventually what occurred was X-rays, and X-rays became our test for tuberculosis. And so that came at the end of the 1800s, beginning of the 20th century, and X-rays became endemic to the physician practice. And so people were taken in X-ray to determine whether they had tuberculosis or not. If they did, very often they could not be placed in the regular hospitals because tuberculosis was extremely contagious. And so hospitals were created just for tuberculosis patients. Now, Erie County did not have a tuberculosis hospital until about 1938. And the reason is that it was not because the people did not want it. There were two referendums that were successfully passed in Erie County, and the voters said, yes, we need a tuberculosis hospital, but the county commissioners just didn't have the wherewithal to do that. And it wasn't until 1938 that the hospital was built, but it was built by the volunteers, by the Tuberculosis Association. And the person that we're speaking about today, Dr. Katherine Law, was very instrumental in the creation of that tuberculosis hospital and its inception in 1938.
And one of the things that you mentioned that I remember from the report was that finally when the commissioners did, it was unanimous, I believe, that they supported
Oh,
that
yeah,
initiative once they did.
absolutely.
But one of the other great things
Absolutely.
in your report, and why I want to call people to read it if they haven't already, is that you include those images, like that Christmas flyer that you talked
Oh,
about. And so
yes.
we get a really interesting glimpse into the window of history of what that looked like and the public call to action. And you do such a great job talking too about the importance of testing. And that's something that we hear today with COVID-19, the importance of testing, and then X-ray, the role that the X-ray machine really played with that. But back to Law, I want to talk to you about the fact that she graduated medical school in
Yes, sir.
1904. And in your report, you write, quote, her decision to pursue a medical degree exhibits an unusual strength of character and highlights her determination and courage. Tell us, how common was it for a woman of that time to graduate with an MD, a medical doctorate, and then to go on to practice and be one of the leading practitioners in her area? How common was that, Judy?
It was not very common, and I've been trying to find the exact statistics, and I cannot find them, but this is what all of the information that I've gathered would make me kind of feel that it is pretty much on the mark. And probably less than 5% of those people that graduated from medical schools were women at the time. And we are talking about the 1800s, the 19th century, all the way up to the end of the 19th century. So less than 5% of graduating classes would have been women. It was very unusual. There were some women's medical colleges, and I assume, not knowing exactly, but I assumed that they were created because women had particular diseases, and it was thought maybe that women should be more active in combating these particular diseases. One was in Philadelphia. It is now closed. It is no longer in existence, but it was at the Philadelphia College that Katherine Law went. Now, she was born here in Erie, but probably by the age of 2, her mother had died, and that she was sent with a sibling to Massachusetts. Now, whether her father went with her or not, I don't know, but she was sent to Massachusetts, which we would say would be kind of an area of the United States much more attuned, not to pioneer life, but to a full educational environment. And so she must have had excellent kind of supportive parentage. And so telling her she could do anything she wanted to. And so she went to a teacher's training school. She graduated from that, and then she went on to medical school.
And just 5 years after graduating, she does come back to Erie.
Yes.
So
Yes, sir.
what brought her back in 1909? Why did she return to Erie?
1909. I have no idea. But she does get married in 1913. And the person that she marries is a Dr. Wright, and he is the head of the health service here. We would call him our local Dr. Fauci in a way. Infectious diseases, this would be his. Now, whether he actually worked for the health department, and I'm not even sure. You know, Erie County is one of the few counties of Pennsylvania that has a health department. I'm not sure that it was in existence at that time, but he was in charge of the health services, infectious diseases. Now, the state of Pennsylvania had what we might term a care center for tuberculosis patients. It was downtown in the city of Erie, and he was connected with that. And through her marriage and through her, of course, long medical training, she became very much involved in infectious diseases. And she actually became the head of that state operation. And when the 1938 tuberculosis hospital was built, she was the president of the advisory board. And she, of course, had been on the staff at Hammett Hospital. She was a tremendous, tremendous person.
I was going to say, it was she had a quick rise in leadership, and I'm going to touch on that for a second, but you mentioned it spot on. Erie County is one of only just 10 counties out of 67 throughout the state of Pennsylvania that has a standalone health department. And so in some ways we are blessed by that. And there are greater concentrations of population throughout the state of Pennsylvania that lack the resources of a standalone health department. So what a tremendous resource to have then and to have now. But yeah, with Dr. Law, it seems like she has this meteoric rise into leadership. Talk to us about that. What otherwise do you think led to her finding leadership positions quickly?
Okay, now when she came to Erie, almost immediately she was placed as president of the Erie County Medical Association. Okay, Erie County Medical Association elected a woman as its president. Now, why would they elect Dr. Katherine Law? The reason why is because I think of her great intelligence and her actual background, because it was not that she just graduated from medical school. She had gone on to postgraduate school. So that was both in surgery and in oncology. So she was a person who had extraordinary gifts plus the education to support it.
So we spent plenty of time talking about Dr. Law, and I feel like we could talk about her for hours, and I wish we could. We're a little limited in time, and I want to talk about both of the reports because we are talking about leadership in times of crises and looking at both of these women. So I want to shift to Charlotte Elizabeth Battles now. And so the Battles Bank, and this is how you begin this piece, the Battles Bank remains open when other banks closed during the Great Depression. Walk us through what was happening at the time and how Battles was able to keep her bank open during the Depression.
Now, Charlotte Elizabeth Battles, was the daughter of the largest landowner in all of Girard. He owned a tremendous amount of property in which he grew fruit trees and grapes and other products. He had numerous other enterprises, and he also owned the Climax. He owned the Climax locomotive factory in Corey. He was an entrepreneur. He had one daughter, Charlotte Elizabeth. Battles. Now, Charlotte Elizabeth, a little bit about her background. She did get married. She married a Charles Barber, which is interesting. He was from Washington, D.C. He was an attorney, but the marriage did not last for very long, probably a year or maybe less. And she came back to Erie. Now, this book, which is by Jeffrey Domowitz, and I guess I'm holding it up. This is on Girard, a canal town history, talks a little bit about that relationship, but there are more innuendos, but no clear information about what happened with the relationship in the marriage. But Charlotte Elizabeth Battles comes back, and eventually her father dies, and then her mother takes on all the responsibilities, the multitude of responsibilities, not only the bank, but the property that grew the fruits and all of the vegetables and things like that, plus the Climax locomotive plant. She took on those responsibilities. When she died, of course, those responsibilities went to Charlotte Elizabeth Battles. She became the head of the bank. Now, should I go on or?
You should. Well, one thing I would just note, Judy, I feel remiss if I didn't bring it up because you mentioned in your report, is that, this gets national attention, Battles keeping the bank open. It finds its way into the New York Times. But do go on. Tell us more about Charlotte Elizabeth Battles.
Now Charlotte Elizabeth Battles in 1933, which was when Franklin Delano Roosevelt became president. Now at that time, presidents took office in March. So it was about March 4th that he had his inauguration, became president. And right on the 4th and maybe the 3rd, there was a tremendous run on all of the banks of the United States. And it was a very a climactic time where you could see bank failures all throughout the United States. So what he announced immediately, probably on the 5th, he said by the 9th, every bank in the United States will close, and there will be a bank holiday. And that holiday will be used by bank officials to get their affairs in order. And they must have sufficient deposits in order to reopen. Okay? So this was an order from the President of the United States ordering a bank holiday, a closure of all the banks, and for that purpose, they were to review all of their operations.
I have this picture in my head, Judy, from the movie It's a Wonderful Life, when you see people running in to get their deposits and get money out. And it sounds like it was a real crisis at the time, but one that, you know, the president sees a way to hopefully avert that there's not going to be the run on banks. But as the banks then go to close, Charlotte Elizabeth Battles says, no, we're staying open.
Okay, now this is what is interesting to me. She wasn't even in Girard when that order came through. She was in California, but she was immediately telegraphed. Now, we would use the phone today, but she was telegraphed that this was an order coming from the President of the United States to close the bank. And so she sent a telegraph back, okay, saying, no, stay open, okay? And what was interesting is that apparently telegraphs were not as secure as phone messages. And so the whole community knew what she had ordered her bank to do to stay open, okay? So they remained staying open. Now, apparently there was a run on the bank and there were individuals that came in to take out all their money, and she said, fine, give them all their money. Make sure that every depositor has what he or she is seeking, okay? So nobody was shorted. But once they got out and then they've left the bank, this is the story that is told in Domowitz's book. Then they were asked, well, what are you going to do with the money now? And they said, oh. And they walked back into the bank and deposited it.
Wow.
Now, that's exactly the story that he tells in the book.
So
Okay?
it's so interesting to see the panic on behalf of the public of running in to get their money without really thinking through what are you going to do with the money afterwards. And here you have a bank remaining open. Aside from that telegraph back from California, one of the other great anecdotes that you have in the report that you've written for us about Battles is that she actually writes to the president. So she writes to FDR. What does she tell him, and how is that received?
When I read this, I just thought this was the mightiest message I had ever heard in my life from anybody, any political official. And so this is what she writes, and I'd like to read it. Mr. President, she says, Mr. President, since I do not presume to tell you how to run the country, don't you presume to tell me how to run my bank. We're minding our business, you mind yours. See Elizabeth Battles.
What a correspondence to send to the President of the United States.
Absolutely.
To say, don't meddle in my affairs and I won't meddle in yours. So
right. Now, one of the things that everybody should know is that the Battles Bank was unusual in the sense that it was a private bank. It was privately owned and a private bank. Many other banks were corporations. They were public corporations, or they were, in some way attached to the public area. But the Battles Bank was a private bank, and so she felt, because they were a private bank and in no danger of closing, and they had sufficient deposits, and they had an organization that allowed them to conduct their affairs, banking affairs, in a way that did not jeopardize their depositors, that she was absolutely on level ground by telling the president, excuse me, to buzz off.
So we see that Charlotte Elizabeth Battles remains with the bank throughout the Depression. and afterwards.
Yes, absolutely.
And eventually the bank does merge. But tell us a little bit about the history of the bank, and then finally her retirement.
Well, Charlotte Elizabeth Battles was just more than a banker. She was also a philanthropist, okay? And of course, she never had any children. And the question is what would happen to her affairs when she died? She did have a friend that she had a lifelong friend that lived with her. And when she died, her affairs were turned over to that friend. But it was her dictate that this philanthropy that she had been involved in continued. So she had helped to establish the library in Girard and many other things. The Girard community owes tremendous amount of gratitude to the Battles family because they were always there to support them in all of their endeavors.
Well, and again, I feel like this is a person that we could spend so much time unpacking, but one of the things I don't want to miss from your report, I don't want to give it all away because I do want to encourage folks to go and read that report as well as your look at Dr. Katherine Law. In that report, you note that, quote, a depression today similar in magnitude to the 1929 Great Depression would have far less impact on the average depositor. It would not see a run on banks. It would not lead to bank failure. Tell us how you got there in terms of being able to say that with I think, a confidence that is reassuring to us right now as we are in the middle of a crisis.
Well, as you know, today, when you deposit your funds into banks, whether it is a bank or a credit union, the federal government has a corporation. It's a federally created corporation in which they guarantee all of the funds, the depositors, up to $250,000. So that was created in June of 1933. But at the time of this run on the banks and President Roosevelt's closure or his holiday, so-called bank holiday, this corporation did not exist. And so the federal government turned around, created it in June of 1933. And it guarantees even today every single deposit made in banks and in credit unions. Up to $250,000.
So Judy, one of the things that I think happens to us when we find ourselves in times of crisis is we keep trying to look to the future and figure out what tomorrow is going to bring and what we see ahead of us. As an historian, you're so good at looking behind us to the past to help inform us. So give us a sense of, looking at the leadership in public health crises and a nationwide economic crisis. What for you are the biggest takeaways and lessons that we should learn as we study the story of both Dr. Katherine Law as well as Charlotte Elizabeth Battles?
Okay, returning to COVID-19, I see a couple things. First of all, we're talking a lot about testing, and now they have developed tests that are apparently fairly accurate. So we can tell whether somebody has COVID-19. One of the things is as far as I know, there's no treatment modality. So if you get COVID-19, you're in the hospital, you're very sick, but there's no treatment. That's one of the things that tuberculosis, they developed not only the test, okay, which would have been the X-ray. The X-ray determined, yep, you were tuberculous, but they also had treatments that were available. Now it didn't mean that nobody died of tuberculosis, but there was a treatment. So I think one of the questions I have is, are we working towards a treatment of COVID-19? And then, of course, we're looking towards the vaccine. And that's one of the things I think that's so significant is that, of course, tuberculosis, there was developed a streptomycin, okay, that was what we would call a vaccine. It wasn't duped, it wasn't called so-called vaccine, but it was something that immediately redress the causes of tuberculosis. And so by the 1940s, tuberculosis no longer was the epidemic that everybody kind of feared. And remember, up until the end of the 1900 or the 1800s, okay, the 19th century, 100,000 people a year were dying of tuberculosis, much more, much greater than what we have with COVID-19.
And
it was worldwide.
And on the flip side of that coin, because we now talk about hand in hand the impact both on our public health, but the impact on our economy, and that's a conversation we're having in the moment. You know, today is, you know, May 7th, and 24 out of the 67 counties in Pennsylvania shift to lesser regulations and restrictions tomorrow on Friday, May 8th, and many other states are experimenting with this, you know, with a leading call being to restart the economy or to get economies back on track. So lessons that we can take away from having gone through the Great Depression through the lens of Charlotte Elizabeth battles, things that we can take to heart there as we study history to understand our present, to envision our future.
One of the things that I look at, and I'm really questioning, is whether we're overreacting. Now, I don't mean that COVID-19 is not a serious threat. Yes, it is. I don't mean that we shouldn't be testing for it, and we should be identifying it wherever it is and making sure that those people who do test positive either are sequestered or that they're hospitalized, they're separated. This was done with all of the other pandemics that we have. But the shutting down of the entire economy creates another kind of sector which could cave in, which could cause an equal amount of damage. People not having sufficient food, not having the wherewithal to get themselves from point A to point Z, you know, no work, looking at a very bleak future. So I think that we have to be very wise. I think looking at the past, how we dealt with similar pandemics and using that to apply to this COVID-19. It doesn't look to me like we're going to get out of this anytime soon. One of the other things that I would just say is the private sector with tuberculosis. Remember the Christmas seals? Okay, and how the private sector came together and said, we're raising the money, we're going to do this investigation, we're going to do the science, we're going to get a handle on this disease. And it was the private sector in Erie County that built the tuberculosis hospital on East Gore Road. The county couldn't get it together. The county just couldn't get it together. So the Tuberculosis Society raised the money, they purchased the property, they built the building, and then they gave it to the county.
And you have to think that somewhere along the line, they didn't stop to think, where do we need to ask permission to do all of that? That instead it was, let's do. And let's see the private sector really rise to the occasion. And I think that that's such a great takeaway, Judy. I think the other takeaway that's so key to this is the testing with the x-rays and when it comes to tuberculosis, and then perhaps the cool, calmer hand of Charlotte Elizabeth battles in allowing the bank to remain open, allowing people to come in and take all of their money only to walk out the door to realize they don't have anywhere to put it. They'll turn right back around and put it right back into the bank. Judy, you started off this conversation, and I think we'd be remiss here as we're closing up if we didn't note it again, that here we are talking about two women leaders who impacted Erie's history and from whose lessons we can learn great things. We're talking about them in 2020.
Yes.
And so 2020 is such a remarkable year.
Isn't it?
Tell us why tell us why it is, Judy.
COVID-19 will always overshadow 2020, but to tell you the truth, 100 years after the 19th Amendment was adopted, we should celebrate, because women need to be included. They need to be full partners in the economy, in our social fabric, in our political fabric, and we benefit as a result of it. These two women, these strong, wonderful women, contributed tremendously. They prove the point.
And what a great note to end on. I do want to encourage people to go and read both of those fantastic reports from Dr. Judy Lynch. They can be found on the Jefferson's website. We have sent them out via email. We also have them available on all of our social platforms, and there's much more to come from Dr. Lynch. In fact, we have a report coming out soon on Talon and the invention of the zipper. Judy will be talking about that in a new report, as well as plenty of other things. But to you, Dr. Judy Lynch, a big thank you for taking the time to join us here for the Jefferson's digital programming today.
Well, Ben, thank you very much for having me, number one, and for your friendship and for the Jefferson.
Oh, Judy, you are wonderful, as are all of you who are joining in to watch us. A big thanks to you for watching along at home, whether you were watching live on our Facebook page or watching a later broadcast of this, thanks to our hosting on our YouTube channel. To read either or both of the reports from Dr. Judy Lynch that we discussed today, head on over to the Jefferson's website, www.jeserie.org. There you're also going to find new reports by her tomorrow. That'll be up, as well as other reports that we've published that are fascinating from other great contributors to the Jefferson. And you can see videos of all of our past Jefferson programming here digitally, and you can see what programs we have on the horizon coming up as we continue to explore digital programming. And of course, be sure to like us on Facebook and follow us on Twitter and Instagram. For the Jefferson Educational Society, I'm Ben Speggen. Be safe, be sound, and thanks for listening and learning with us today.
Thank you, Ben.